South Africa's COVID-19 infections are continuing to skyrocket, with a total number of infections in the last 24 hours at just over 22,400. The country has seen a tremendous rise in infections for weeks now. Hospitals are barely coping with this rapid increase in infections. Infectious diseases specialist Dr. Jeremy Nell joins me now for more on this. Jeremy, it's good to have you with us. We were hearing that we are in the midst of our peak, but this should continue for at least 2 to 3 weeks. From what you are seeing, is that correct?
In Gauteng, it looks like we're getting close to the peak, but I mean, this peak has been horrendous. It is worse than either of the two waves that have come before us. The other provinces, or at least most of the other provinces, are still shooting up and some weeks behind Gauteng. So I think that the other provinces are in for what Gauteng is in for now. In the coming weeks, though, they've still got to get there. And the situation in South Africa will get a lot worse with COVID-19 before it starts to get better. It's dismal out there at the moment.
What should we be reading into the facts coming from hospital now, is that many of those who've been admitted are younger and younger? We also heard a little earlier on that babies under 1 year old are very vulnerable to this variant.
Yeah, I'm not sure that the age distribution has changed that much. I think what we're seeing now is just the huge numbers of infections. And so there are more, even if young people are relatively protected, there's still a lot of young people in hospital at the moment. And it's certainly not unheard of to have people in their 20s and younger dying of this disease, even though it definitely still affects the older people more. It's just a situation of being overwhelmed in Gauteng. You know, we have over 22,000 new cases today, as you said, more than half of them in Gauteng. The hospitals are not coping, and that's been admitted to by the provincial MEC even. And it's really, it's driven by this Delta variant, which is super infectious, and really it's at least 50% more infectious than our previous variant. And it's driving these infections up at an increased rate, and compounded, of course, by not having enough active beds in many of these provinces, including Gauteng, to cope with these excess numbers.
If these variants continue to mutate as they are, what are we expecting in, say, the next year?
Yeah, very difficult question to answer. It is changing, as you said, and I think that there is a natural tendency for many viruses to become more transmissible with time. That's certainly what we've seen from the original strains, then to the Beta variant in South Africa, and now to the Delta variant in South Africa, where each time it's been more infectious. And I think that, again, I don't see any huge reason to assume it won't mutate again and become even more infectious. But the way to solve this is not to sit helplessly, of course, is to vaccinate as many people as possible, as quickly as possible. And that way you break this connection between the cases and the severity. If you can vaccinate enough people, and we've not done a good enough job in South Africa at that, but if we can vaccinate more people, then by the time you have the next variant, the impact is far less. And that's really got to be the aim. This is a very frustrating wave to be facing as a healthcare worker, because so many of these deaths were preventable had we had vaccinations be more widespread earlier.
I mean, it really is a shame, isn't it? And you hear that how badly we're doing compared to the rest of Africa. I mean, there really is no excuse, but this is where we are. Knowing what you do, how long can the vaccinations that we've had, that we've been lucky to have, any idea how long they last?
It's an area that many people are researching, and you can imagine, it's not yet known because this is all so new. But so far, the evidence is that the vaccines last a good length of time for at least the protection, the significant amount of protection lasts for as long as people have looked. In other words, now with the J&J vaccine, which we started with in this country, there are very good results at 8 months and counting, and I don't think there's any significant evidence that the key part of the vaccines, in other words, the ability to prevent severe disease and to prevent death, don't think there's any good evidence that that seems to fade within the time we've looked. So the key is really to get any vaccine, any good vaccine, in as many arms as possible, as quickly as possible, and prevent the death and prevent the hospitalizations. Even if the new variants come that maybe make it a bit harder to prevent mild disease, that's not the priority for the vaccines. The vaccine's goal is to prevent death and hospitalization. And so far, they all seem good at that, and they all seem like they will be good at that for a very long time.
We've had this for some time now. What have you learned from the hospitalization of people? Is there anything that we could be doing better, other than obviously getting vaccines in the arms? Medically, what could we be doing?
Well, I mean, the big reason that there's so many excess deaths at the moment, and that's probably the fairest way to count, is excess deaths rather than COVID deaths that are reported, because so many go unreported because people just don't test, or they die at home, or they're too scared to come to hospital. But the big reason for all these deaths is the overwhelming of the healthcare system at the moment. And so really the biggest thing, we have adequate drugs to treat people with. We have, for the most part, adequate oxygen, although that is increasingly going to come under strain in the third wave unless people are very good about how they use it and making sure that the infrastructure in the hospitals is good enough. But the biggest thing is to make sure there are enough active beds. It's no good building facilities like have been where there's 500 or 600 beds with only 50 of them are being used because there's staff for only that many. So really the biggest impact you could make is to make sure there are enough active beds for this enormous wave that's coming. And that means that there is doctors, nurses, oxygen and drugs for each of those beds. Not just an empty bed, but an active bed. And if that can be done, then the other provinces outside Gauteng, which are a couple of weeks behind, have the best shot at saving the most lives.
Jeremy, very good to talk to you. Thank you.